right, thanks so much, Pete. And parents, if you have a little bit of time to sit down and listen to some important information in our Nurses Know segment, we have RN Darcy Hodge here from East Tennessee Children's Hospital. Thanks for being here. We know that there has been at least one child in North Carolina who has died from the flu. This is the first this season, but this happens a lot that people don't even realize maybe.
It does. There's usually over 100 children a year who die from flu, complications from flu.
And talk about how flu season is going as far as East Tennessee is concerned. Are you all seeing a lot of cases?
We're seeing just a handful right now, which is normal for this time of year. As it gets colder, though, we expect the number of cases to go higher.
And that makes it even more important for the vaccine.
Yes.
So what would you say the importance behind that is, and for parents to take this seriously and get the vaccine now for their kids?
Well, it's very important to go ahead and get it now because it takes 2 weeks from the time you get immunized for your body to build up the immunity that it needs to fight the flu vaccine. This child who died, we don't know what their history was or what their story was, but they only had to come in contact with one person with the flu in order for them to get it. So the earlier we can get our child immunized and protect them, the better chances they are to have a good season, a good year.
And we know that the general complications of flu, but can you just talk about those again to remind parents?
Yes, one of the common complications is pneumonia, bronchitis, sinus and ear infections, and then when our children don't feel good, they don't eat and they don't drink, and so dehydration becomes very common, and that can be very severe in a young child.
Yeah, and especially with the younger children, what are some of the signs you can look for that might alert you that something just might not be right?
A lot of times they're just not feeling well. It comes on kind of suddenly. They'll have a sudden fever of over 100. They'll have the sore throat, the runny nose, and they're just not eating and drinking as well as they used to. That, and like I said, flu comes on suddenly, and so those symptoms can come on suddenly, and they can get very sick quite quickly because of those symptoms.
Yeah, and I'm sure the age of the child too doesn't even really matter when you're dealing with something like this.
It really doesn't. Younger children who are too young to get immunized can have worse cases of influenza and worse complications, and then older adults also, 65 and older, can have complications from it.
Darcy, great information.
Thank you.
We'll have all that up on local8now.com. For now.